As we get ready to start the school year, many parents are wondering if they should vaccinate their kids against the flu and COVID, and there's a lot of misinformation out there. So let's separate fact from fiction and look at what the science says. I am an assistant clinical professor in the Department of Family Medicine at a major medical school. I take care of kids, adults, and elderly patients at a community health center in a large city. And I'm triple vaccinated for both COVID and the flu. First, let's talk about the flu. The CDC recommends that everyone 6 months and older get a yearly flu vaccine. The flu shot is updated every year to protect against the strains of flu that are most likely to be circulating. It takes about 2 weeks after vaccination for the antibodies to develop and for the vaccine to take effect. And it's most effective at preventing the flu during peak flu season, which is usually from December to February. But it can still be effective in March, April, and even May. Getting a flu vaccine protects you from getting sick with the flu, but it also helps prevent the spread of the flu to others, including those who are at high risk of serious complications from the flu, such as young children, pregnant women, older adults, and people with certain chronic medical conditions. This is called indirect protection or herd immunity. When enough people get vaccinated, it makes it harder for the virus to spread, which protects those who can't get vaccinated or are more vulnerable to severe illness. For example, babies are too young to get a flu vaccine until they're 6 months old, so they rely on herd immunity to protect them during their first year of life. Last year, over 150,000 children under the age of 5 were hospitalized with the flu. That's why it's so important to vaccinate everyone who can get a vaccine. Now, let's talk about COVID-19. The CDC recommends that everyone 6 months and older get a COVID-19 vaccine and booster when they're eligible. There are a few different types of COVID-19 vaccines available. mRNA vaccines, like Pfizer and Moderna, have been shown to be very effective at preventing infection, severe illness, and death from COVID-19. Some of the newer bivalent booster shots contain mRNA from both the original strain of COVID as well as the Omicron variant. These new boosters may offer better protection against newer variants than the original mRNA vaccines. There are also some misconceptions about the Johnson & Johnson vaccine. The CDC recommends that if you started with the J&J vaccine, you should get a J&J booster shot. But there's no data to support that. You should get whichever vaccine is available to you to get boosted. In general, it takes about 2 weeks after vaccination for the antibodies to develop and for the vaccine to take effect. But this can vary depending on a number of factors, including the type of vaccine, the strength of your immune system, and whether or not you've had a previous infection with either the flu or COVID. While vaccines are most effective at preventing infection and severe illness during peak flu and COVID season, which is usually in the winter months, they can still be effective in the spring and summer. There are many different ways to get a flu shot and COVID booster, including at your doctor's office, at a community health center, at a pharmacy like CVS or Walgreens, and even at the grocery store. I encourage you to get your flu shot and COVID booster as soon as possible if you haven't already done so. If you're concerned about side effects of the vaccines, please talk to your doctor. In general, vaccines are very safe. Possible side effects from the flu vaccine include pain, redness, and swelling at the injection site, as well as a low-grade fever and body aches. Possible side effects from the COVID-19 vaccine are similar and may include headache, fever, and chills. Most side effects are mild to moderate and go away within a day or two. Serious side effects are rare. I think the most important thing to remember is that you're not alone in this. We have a team of doctors and nurses and pharmacists and medical assistants who are here to help keep you and your family safe from vaccine. Preventable diseases like the flu and COVID will be here for you every step of the way to answer any questions you have and to help you make informed decisions about your health and the health of your family. If you're still unsure about whether or not to vaccinate your kids, talk to your pediatrician. Your pediatrician knows your child specifically and can answer any questions you may have about the vaccines. They can also explain the benefits of herd immunity and how important it is to protect those who are most vulnerable. You can also check out the CDC website for more information on vaccines for kids. Thanks for watching. Take care of yourself and be well.